everyone, my name is Dr. Kajal Tutt. I'm a dentist, a foundation dentist working in London at the moment. I studied at King's College London. I thought I'd just kind of talk through my journey of how I got into dental school, what the journey involves and what foundation year involves as well for dentists, because a lot of people know about what foundation years mean for medicine and for medics, but when it comes to dentistry, a lot of people don't really know what that means. So for me, I kind of got into dentistry from doing a bit of work experience in different fields, and I found that kind of dentistry really spoke to me. I like the way that you can build a patient relationship, you can see patients every 6 months regularly, you really do get to build a relationship with them. It's not as if you're always seeing patients just when they're in pain and just when they have a problem and just when they're angry with you. But you do actually build nice relationships, and you have patients who come back to you and will ask to only see you and that kind of thing. And people do get quite attached to their dentists. And I kind of like that kind of relationship that you can build. And that's something that I thought really early on, it built in my communication skills, also my kind of healthcare, and also science. And also it's practical. I'm not someone who can just sit there and kind of just sit behind a desk or sit in a lab. I need to be doing something. And dentistry really allows me to combine all of these things into one career. And I think that's what kind of drove my passion into dentistry. When I was applying for dentistry or thinking about applying, not all teachers in my school were really kind of encouraging me to do that. And the reason for that is because my school was quite a low achieving state school, and I think in order to kind of protect me, they said, a few of them said, don't apply for dentistry, you're not going to get in, so just do something easier that's more guaranteed for you to kind of actually get in and succeed. But me being me, I ignored them and I tried, and I'm glad I did. But I feel like these kind of voices in my head has fed into a little bit of imposter syndrome that I have kind of taken with me in my career that I'm still trying to overcome. So as I said, what I did was kind of do lots of work experience in different fields, and even within dentistry, I did it within different fields as well. And what I mean by that is I did work experience within a dental practice, so a general dental practice, kind of NHS practice, just to see what everyday general dentistry is like in the high street. I also did some within dental hospitals. I did some work experience in Chelsea and Westminster Hospital within the children's dentistry department, which is a real eye-opener, I think. I would describe that as an eye-opener. And I also did some in Eastman Dental Hospital, which is a specialist hospital, and I did it within kind of admin role to see what happens behind the scenes. I think that was kind of a good range of experiences that made me make a solid decision that I do want to go into dentistry and it is the career for me. So obviously I had to get the A-level grades, and now the grades are much higher probably to when I kind of applied, but that's something you're going to have to research yourself. So A-level grades, interviews, that kind of thing, personal statements, we all know about that here and there. So I'm going to go on to dental school. So first year dental school for dentistry, I went to King's, as I said. I mean, it's not very focused on dentistry. It's more kind of getting an appreciation for the whole of the body, because it's quite similar to medicine in that aspect first year, because you want to kind of know how the body works, how pharmacology works, how medicines work, that kind of thing, before you get into the teeth, because the mouth is connected to the whole body, contrary to popular belief. Okay, so that's what we did in first year. And second year, we started getting onto the teeth and the practical skills. So what we did was we go into clinical skills labs and we start working on the teeth in fake jaws and fake people. And that's when we start building your skills for dentistry. And this was something that was so foreign to us, because obviously we've never done that before. When you go into dentistry and you think about dentistry, well, I know what I was thinking about when I was applying. I thought, I'm going to have a good job, I'm going to be working 9 to 5, and it's going to be a breeze. I didn't actually think about what I had to be doing practically. I thought that would just come. But it's a skill that you really have to learn and you have to work at, and at first you feel like you're bad at it, but it comes. Even now sometimes I feel like I'm bad at it, but it's all a learning process and you will improve. So that's kind of second year. Third year is when they start introducing you to patients, and that's when you're shaking because, oh my God, there's a patient you're going to see, and it's all scary. But after you see the first patient and you do your first injection and you do your first filling, it's the feeling that you feel when it actually goes well and you've managed to do that it's amazing. And this is why I like dentistry, as I said, because you can learn the skills and you can learn the theory, but putting it into practice with patients is a totally different story. And seeing the satisfaction that you can bring to people by just taking a tooth out that's causing them pain, giving them a bridge to make them be able to smile again. Anything, so it's just little things that you think is quite little, but to them, it's a big deal. It changes their life. And this is why I went into dentistry, and this is why I enjoy it. As I said, third year, that's kind of what you're introduced to patients very slowly. You start doing simple procedures on them, maybe a bit of a clean, maybe a simple filling, that kind of thing. You start learning about dentures, these kind of things. Fourth year, as I said, you just build on those skills. We're constantly learning theory in the background, but doing it in person, doing the practical skills and having your supervisors come over and tell you where to improve, and that kind of thing is so invaluable. And it's dentistry, I always say dentistry has been the most humbling experience for me, because prior to that, I've always received top grades in my school, awards, all these kind of things. I was a high achiever. I wasn't used to failing. I wasn't used to criticism. When I did something that I thought was great, and a supervisor who's been doing dentistry for probably about 30 years has obviously said, no, you can improve this and that, I used to get offended. I was so upset. I used to be in a strop and not want to talk to them for the afternoon session. And that was at the beginning. But then it really had taught me to take criticism. And now I'm jumping to learn criticism. I'll be asking on my study days and the courses I attend, please come over, tell me how I can improve and how I can get better. And I think that attitude is good in all aspects of life, not just dentistry. You have to be willing to take criticism to improve, and that's the only way positive changes are made, in my opinion anyway. So that's something that dentistry has definitely taught me, but I think for young dentists or people who are going into dental school or thinking about dental school, I would have liked someone to tell me to just humble myself and be able to take and kind of accept criticism a little bit better and a little bit earlier, because it did take me some time, I'll be honest, and now I'm grateful for it all, and I'm grateful for all the criticism I've received. As I said, it's not always easy, even at the moment. I'm in foundation year, so that kind of is with dentistry, you pass the year knowing that you're competent in lots of different things. You pass dental school knowing you're competent in certain things as well, but you need to really get that sheer experience and the sheer workload in, and that's what foundation year is for. So you kind of see patients all in the NHS practice. So just to get more used to doing things faster, the whole kind of care plan of a patient, so it's not as if you're just doing one piece of it just to tick a box. You're actually seeing a patient from the checkup all the way to the end of their treatment. And I think it allows you to build interpersonal skills a lot better and just get better at what you're doing, the practical side of it as well. So also with that, we do have support. We have an educational supervisor in the practice who is always available to kind of, if you need any help, if you need any assistance and that kind of thing. And also we have additional study days and that kind of thing to kind of just help reinforce the knowledge that we have and always be improving. In any healthcare profession, you need to realise that it's not going to be 5 years or 6 years of studying. That you can't think of it in that way. Healthcare professions are a lifelong study. Everything changes. Healthcare changes, evidence changes. You need to be on top of it all the time. So if you want a career that's just going to be, you learn the content, you do it, and you don't have to look at a book or look at an article or anything again, it's not the career for you. You need to find something that you enjoy enough to be learning it for life. And that's what dentistry and healthcare professions are, in my opinion. Yeah.